Welcome to Compleat Kidz Online, friendly discussions about autism and other developmental disabilities. Learn how working together is working better, one conversation at a time.
Welcome to this week's edition of Compleat Kidz podcast. For the second time, we're going with our sister organization, which is Compleat Rehab, which, if you didn't catch the episode with Rebecca, is an organization that treats adults. And our guest today is Alex Young. He'll get into it a little bit more, explaining exactly what they do and some of the different things. Rebecca just gave us a quick overview. Alex will get into a little bit more of the meat of the subject. So if you're a parent of one of the kids, or if you know somebody that needs physical therapy, give us a look, and we'll at the end of the podcast we'll explain how to get in touch. So welcome.
Thanks, Bob. Yes.
I can actually vouch for Alex because Alex has actually fixed two of my problems. So I'm going to give him a thumbs up. If you really do need a physical therapist, Alex is definitely a guy I would recommend from actual previous experience.
Yeah, one of the benefits of working for a PT company is you get therapy. Although it's sometimes therapy whether you want it or not. I'm actually also a current patient of our therapist.
Well, I was going to get into that about how Alex not only plays one on TV, but he actually is one.
Yeah, so we'll get that out of the way. I am going back into the clinic after a misadventure on a bicycle. I launched myself off a bicycle downtown and broke my arm, so I got some shiny new hardware. And I've seen a couple of the...
Oh, do you bounce metal detectors when you go through now?
No, I haven't flown yet, but I've been to a couple of concerts and they don't even it doesn't even ding.
Okay.
So either, I'm pretty sure it's a steel bar, I don't think it's titanium, but
okay.
I've not gotten selectively screened for anything yet. So I broke my arm, got a plate, I did some soft tissue damage in my wrist and my shoulder, and so I've seen a couple of our therapists in Gastonia and Mount Holly. They're taking good care of me. And definitely put me through my paces. I had seen a couple of patients that I had previously treated in Gastonia, saw me getting treated there.
Oh, that's funny.
Every one of them used the phrase "taste of your own medicine." But yes, that's not my first foray into physical therapy. I did that in high school. That was actually how I got introduced to the profession, was with a knee injury in high school. But this was definitely a livelier one and not my smoothest moment.
The bike accident, I'm assuming you mean.
Oh yeah, so the bike hit a train rail and stopped. I took a wrong angle across it. I should have taken the sidewalk. I was in the bike lane, but I hit something in the bike lane and the front wheel came to a complete stop and the rest of the bike and I did not. So I endoed, went over the bars. There was called a foosh, falling on an outstretched hand, which is how we get in a lot of patients. And so I broke my forearm, got a plate with 8 screws, dislocated my wrist and tore my rotator cuff.
Does it hurt, or is it it's so bad that you don't feel it?
Well, it hurt pretty good then.
Yeah.
Because I don't actually remember wrecking. I just went over the bars. I was wearing my helmet. And was wearing my helmet, and so I hit that. And I remember trying to sit up and push up my arm and be like, well, that's a weird grinding feeling. And then I think that's broken. Then I sat up and saw the angle that my forearm was at, which there's not supposed to be any angles in there. And there was a jaunty angle, I'll call it. And I'm like, well, I've broken that. So I got a short ride on the ambulance and went to the Newmont Presbyterian location, and then they patched me up the next morning.
So I know you meant, what do you call it? The foosh?
Foosh, fall on an outstretched hand.
Yeah, and that's it goes against everything we believe are programmed as human beings. But I know it's the worst thing in the world to do is put your hand out when you fall.
So if it was between breaking my arm and cracking my skull, I've got another arm over here, right? But that's one of the reasons you want to wear a helmet, right? Because accidents happen so fast. So even me, of all the admittedly ignorant stuff I've done on 2 wheels between a bicycle and a motorcycle, like mountain biking, trying to jump stuff, I was riding on flat ground over a train track downtown. It's a very unexciting story.
Right.
But that's what got me. That's something that happens to folks who theoretically know what they're doing, and also that it happens really quickly and to anybody. So that is something, like I said, it took me a while to get over with the soft tissue damage because that does heal slower. But between both trying to treat myself and getting some advice from my wife, who is also a therapist, and then the treatment that I got from the folks out, like I said, in Gastonia and Mount Holly, my arm's coming along pretty well, and it's better every week. But it's an interesting experience, knowing what your therapist is just trying to do and trying not to back, lead it, like don't get ahead of them because it's my job is to be the patient in that category.
Well, I was going to say, was there any tension between you?
No, because like I said, that's one of the things, especially if you work in one of the larger clinics, we all treat each other for like, hey, like my shoulder's got a thing, like, whether it's like I was working on the house or like my dog took a funny turn or, like I yeeted myself off a bicycle, you treat each other for that. So there's no any tension there because, I trust them with treating me for whatever.
Right.
But it is just a different, experience being on that side of the coin for as long as I've been on that. No, I do much prefer to provide treatment than to, need it or receive it. But I'm lucky that I'm in a place that I'm able to get good care.
Do you think it changed your perspective a little bit?
A little bit, yeah. Like I think it, you can have empathy for your patients. You can like understand from like a clinical sense or from like a related experience that you've had. But for folks that have had, like the distinct and sudden pain of a rotator cuff when you put your jacket on wrong with like the seemingly like innocuous things just taking you to your absolute knees, that does create, I think, a little bit different empathy. Like it's something that you warn your patients against, but if you were like warned like, hey, when I did it, it either carries a little bit more weight because they know you've experienced it directly, or it's just you can give them a little bit different example for something that anytime you're trying to do any patient education or trying to do like activity modification, it gives you a little bit more insight into like the mundane stuff. Like I've got longer hair now, like I couldn't put my hair in a ponytail, and I went through every just because of well especially when my arm was in a cast, I couldn't bend my elbow far enough, and I couldn't lift it over my head because my shoulder hurt. And so like I would want my wife to put it in a ponytail for me, or I put it I got like a neck gaiter pulled over my head like Shmee, like from Peter Pan or something like that. I even tried the thing where you put it in like in a vacuum and like try and pull it back, but I have too much hair for that, it's too thick, and that I was glad my wife wasn't home for that one. She would still be laughing about it, I think.
Yeah, that's an awkward position.
Yeah, it was. I was just angry about it. Like I just need my hair up. I tried to get like a neck fan. I got my hair caught in the neck fan, and it yanked a patch of hair out, which was a lively experience. So there's a lot of things that you don't necessarily think about until you've had to do them. So even as a therapist, when you like try and think through like, okay, all the movements this body part or this person's going to have to do with whatever activities they've told me about, having to be like, okay, no, when you like try and pull up your pants and like your arm doesn't reach around and like okay, like this is how you're going to do it without hurting your back, okay? Right. And so the things like that, they give you just a little bit more insight or a little bit different approach to some things. Or when somebody asks, you're always a therapist, just because, we're in the small talk in the clinic, like, if you was a therapist, have you ever had therapy, like, how'd you get into this? And I'm like, well, this is my experience in that. So it's just a way to build rapport with folks and get some common footing and some common understanding there.
Well, enough of the war stories.
Okay, yeah.
Let's talk about, why you're here today, just to give us a little, I know we talked about a little bit before the film started rolling, was, don't tell me.
Well, like pain science,
needling.
Dry needling, some pain science, some patient education, all those things are tied together.
Yeah, so let's give our folks out there a little bit of
so for the dry needling first, I guess because that is honestly a shorter topic than the pain science, that can be a whole podcast to itself, but the dry needling is a technique that physical therapists and a few other professions use, and to a lot of folks, they walk in and it looks like acupuncture. Uses a very small needle, like 0.2 millimeters across, so it's very thin. But a lot of acupuncture needles, a lot of acupuncture techniques rather, will stay pretty superficial, meaning close to the skin. And there are certain benefits to doing that. The techniques that we are using for dry needling do overlap with acupuncture, but it is not acupuncture. And so the needling process is we're looking at a particular muscle group or particular joint that is having some dysfunction. It hurts, there's inappropriate muscle tension, there's inappropriate muscle activation, like you can't turn the muscle on or it won't shut off, these kind of things. Dry needling can help with that. And so the dry part means there's no injectable material. It's not a steroid shot, it's not medication, it's
just
not,
plain needles.
Yeah, it's just it's a thin, sterile piece of metal, and you just put it right in the muscle that we're looking for. And so we can target very superficial structures like some acupuncture, or we can target a lot deeper structures as well, like some of the large muscles in the back, the shoulder, the glutes, like the back of the hip. Some of those muscles are right in next to the joint, and so if you have a large muscular person, or just it's just the location of that muscle in particular, you no longer need to get there.
How deep can we go?
I think the longest one I use on any regular basis in the clinic is probably 70 millimeters. So it's
and that whole thing goes in.
And if you have a particularly large person, you can sink it all the way to the sternum. If I'm doing needling on the thumb or like in the very small muscles of the neck, or for some folks who have TMJ,
which is
the jaw joint.
Mm-hmm.
So if your jaw opens and clicks when it opens and shuts, mm-hmm. or you kind of move side to side, you have trouble eating like big cheeseburgers. Like if you go to what's the place in Gastonia? Kyle Fletcher's,
Oh,
they get
yeah,
like
yeah.
that 2-story tall hamburger, right? I've had a couple patients that I treated there that their specific goal is to be able to eat a cheeseburger from Kyle Fletcher's, which I really truly respect because that
Me
is a
too.
world-class hamburger. However, if you can't open your jaw that far, it's a real problem and it becomes painful and limiting. So if you're like, no, I just want to be able to eat regular things, or if I grind my teeth at night, dry needling can really help with some of that smaller musculature in the jaw that you either use for chewing or for speech. Because chewing and speech are both fine motor skills. A lot of folks don't think about until you have to, think about the dexterity or the endurance required to talk.
Yeah, I didn't even realize that till working here with Compleat Kidz.
Mm-hmm.
All of our speech therapists are trained in a lot of things about eating and stuff
Yeah,
like that, and
it's
swallowing and stuff. So,
Yeah, it's a very complex
yeah.
mechanic and it takes a lot of coordination, and so if you have troubles with that for a variety of reasons, it kind of takes folks by surprise. But so we insert the needle for a couple of different reasons, but the main thing is you put the needle in and it has a certain reaction in the muscle where it'll help cause the muscle to relax. So one of the things that it'll do is when your brain says, all right, muscle, I want to squeeze this muscle, it sends that signal down and your body releases a certain chemical called acetylcholine, but it releases a certain muscle to help contract the muscle, or chemical to help contract the muscle. And for some folks, that process doesn't turn off quite as well. So if you have knots in your, like knots in your neck, if you have knots in certain muscles after like strenuous activity, or for a lot of folks that are at our desk, they get slouchy like this, they get a lot of tension in some of the larger, or not necessarily larger, but tighter, stronger muscles. And so we can put a needle in to help kind of interrupt that process, helps the chemical clear out, kind of like if you have to put a parking guard in front of the Walmart parking lot on Christmas Eve, right? There's too many cars in there, it's one in, one out, nobody's got any space. Parking guard comes in and says, hey, no more people in, scoots all these folks out, makes you a lot of space, everything frees up and relaxes a bit, right? So we can do that to particular muscle groups, and we do it because the needle is so fine, do it in a very particular area. And we can do that as many locations as we need to, right? And then to add on to that, we can hook it up to an electrical unit, like an electrical stim unit.
So is that like TENS?
It's a similar technology. It's like if the TENS unit went off to the Marines, it came back beefed up. So TENS operates a lot closer to the skin, and it operates a lot higher frequency. So TENS operates at 150 to 300 hertz. So it makes that nice buzzy, tingly feeling. So it's very non-distinct. You can spread it out like with the sticky pads on the skin, so you can move with those. That's one of the benefits of TENS is you can put the pads on and still keep exercising. You can take a nap, you can take a walk, whatever. With dry needling, you don't want to move around a whole lot because you've got a needle sticking out of you. But the depth of the needle allows us to target deeper musculature without losing some of the intended treatment to muscles or fascia or fat or skin in between the origination of that signal and where we're trying to target. So if I want to target, for example, your piriformis, that's a deep muscle right across the back of the hip. It causes a lot of folks issues that have weak hips, back pain, problem with walking, sciatica, that's a big one. We can put the needle right in there, help release that muscle, and then use that stem. So instead of the 150 to 300 hertz that the TENS is operating at, this stem unit is operating at 2 hertz or 4 hertz. So it's a much more distinct.
And that current is hooked up to the needles of the dry needle.
Yeah, so the needle's metal, has a little plastic. Most needles have a little plastic. Some have a little spring shaped one, but there's a little gator clip, like if you imagine like you're going to jump your car, just way smaller, and it clips right to the needle there, and we can do that in pairs. So when I've had back to my adventures with the bike, when I got needling in my shoulder, they targeted 2 in my deltoid, 2 in my infraspinatus, and 2 in my supraspinatus. So trying to target 3 different muscles, and so you can tune those all individually, right? So we can align the needles in certain structures or muscles to try and get a little bit broader effect. But with the needling, we really try and target like specific musculature, right? And so then that helps fatigue the muscle because it gets the muscle to squeeze and relax, squeeze and relax, squeeze and relax. And so a lot of folks after dry needling will get like post-exercise soreness. So the same stuff that you would do.
So it feels like I worked out.
Yeah, it feels like, but it's not like you overall worked out. It's like I worked out right there, right? So it's much more localized kind of sensation. So there is some normal post-exercise soreness for about a day after that. Some folks may have a little bit more or a little bit less. It depends on the person, much like exercise does. We always tell our folks, drink plenty of water after that kind of thing. But that is something that we use to help target, let's say, more reticent pain for some folks. So a lot of folks have had, for example, like low back pain is always a good example for that because it's really common in the U.S. A lot of folks have experienced that either acutely after bending wrong when they were moving, or bending wrong for 40 years and now their back just kind of hurts all the time, right? But if they've tried stretching, they've tried exercise, they may have tried therapy before, they've tried injections, they've tried, naloxone or any other like over-the-counter type medications like ibuprofen or something. And if that had like varying effects, dry needling is a different kind of thing because it both helps stimulate the muscles more directly and that, in this case, in the second, the pain science part of what I want to talk about, it kind of interrupts the cycle there that people get, stuck into. It's not a volitional choice that happens, but like your body kind of responds to things in certain ways, and that needling helps interrupt both the physiologic process of your muscle holding too much tone, but it also helps the junction between your nerve and your muscle communicate more effectively, so you have better control over it. You can turn it on when you want to, you can turn it off when you want to, and it affects both the timing of it, so there's not a delay necessarily in terms of either one of those commands.
So what are some things, Alex, that like, me as a layperson, I'm walking around and I have some, pain or some problems. I go, that you would probably say, that's something we should look into for dry needling for.
So,
like typical.
like the answer is always it depends. Because the biggest thing is making sure you don't have a fear of needles, right?
Right.
Because there are a few red flags for that.
Right,
Like
right.
we don't want to do anything near like an active infection, like for cancer,
Mm.
or for if you're afraid of needles, right?
Right.
So I say I'll get to dry needle, and some people be like, I don't even know the rest of that
Yeah.
word, right? And so because if you're afraid of it, you hope you tense up or you're going to have a negative reaction to that. That will outweigh probably any benefits that I'm doing. But if we're looking at conditions that'll do it for a lot of folks, like the most common people that I'm probably dry needling on a daily or weekly basis are going to be folks with, I'll say, chronic neck and back pain. Sometimes acute neck and back pain. After some point, like if you're getting a car wreck and you get whiplash, right? Or if you sit at a desk and you're like, I get really tight up through here, so you get a certain combination of muscles that get tight and some that get weak and stretched out that kind of self-perpetuate, the snowballs on you. Once you kind of get into that hunch position, it gets harder and harder to get back out.
Mm-hmm.
So if we're trying to release some of the tight musculature and then put some electrical stim on some of the weakened musculature, we can help encourage some of those muscles to fire a little bit more appropriately. Because I'll point out, the dry needling is not something we do by itself. We want to do that in conjunction with the right stretching exercise program, but also like massage, manual therapy, manipulation, using things like kinesio tape or rock tape, like the stretching athletic tape to help cue those muscles.
All about it now.
So those are things that it's all pieces of the puzzle. Like, do you need that particular piece to solve this particular problem? Because that's not something we use long term. You don't want to go like once a week for a year, right? You want to go twice a week for a little bit. You get it every couple of days to get over a certain limitation or a certain muscular issue that you're trying to work on, and then that kind of fades in importance or how useful it is as other things take precedent in terms of trying to like retrain your movement patterns, that kind of thing.
Well, we learned a lot today about dry needling. I appreciate you coming by.
Sure.
Would you come by for part 2? Would you hang out?
Oh,
for part
definitely.
2? So we're gonna wrap it up now. But tune in the next 2 weeks. We usually do this as a 2-week schedule. And hear Alex talk all about pain management. Or no,
Right.
pain, was it?
So pain science, pain management,
science.
patient education, all those things go together, and it ties in a lot with what we were talking about with dry needling. So those conversations tend to dovetail in the clinic as well. So definitely come back to talk about that.
So tune in and find out all the interesting things about this kind of stuff. Thanks again, Alex. Really appreciate you.
You're very welcome.
To continue the conversation, visit the links to our website, Facebook page, or Instagram in the comments.